this Christina Marie?
Yes, this is she.
Hi, this is Cindy from Good Hope Hospital.
Oh, hi, yeah.
Yes, I just wanted to let you know we received your application.
Okay.
I just have a few questions to ask you. Are you okay with floating?
Yeah, that's fine.
How long have you been a nurse?
I've been a nurse for about 4 to 5 years.
Alright, looks like everything's in order.
All right. Awesome, thank you so much.
Do you have any questions?
Hey guys, don't be in that position. For my new travelers, there are number 9. So there are 9 questions that I recommend to ask when you are doing your phone hospital interview. Let's just say you're ready to do your travel agency or your recruiter. He sent out your application to several different hospitals and hey, ring, 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 you got a phone call. They want to do a phone interview with you. The person who is doing the interview with you, usually it's a manager or assistant manager of the unit you applied to. They're going to give you a spiel about what patients you're going to be seeing. They want to see if you're comfortable. They'll ask you about floating and any time off basically that you'll need during your assignment. And then they'll ask you, do you have any questions? Don't be that person who doesn't ask any questions. And these 9 questions I actually ask on each interview that I've gone through so far, just because this helps me kind of keep calm from not knowing what I'm actually headed into. These 9 questions that you can ask on the phone interview will help you and hopefully calm down your nerves before you end up traveling over to your assignment. We can start with least important to most important. Number 1, do they have any scrub attire? Do you have to wear a mandatory color or can you wear any printed scrubs or anything like that? It's your first day coming onto a unit. You don't want to end up in the wrong attire and looking unprofessional. So make sure you just ask about that ahead of time just to be on the safe side. Number 2, how long is orientation on the floor? I heard from some ICU nurses that were orienting with me, they didn't get any orientation on the floor. So just make sure to like prep and prepare in your brain like, hey, I'm only gonna get at most 3 days, or hey, I'm not gonna get any orientation days at all. They're gonna tell me the codes and the numbers and then tell me to go and do my assignment. Just kind of prep yourself, at least with orientation days, so you know what to expect. They'll give you your guaranteed time in the sense of getting an orientation. 3, ask them what type of drips they end up doing on the floor. PCUs that I've been on are different all across the board. My progressive care neuroscience area, we didn't do any cardiac medications. If the patient needed like cardizem or anything like that, we didn't push it, or they would end up going to another progressive care floor in order to do that. The PCU floor that I was in Washington, they actually did peritoneal dialysis, they did patients in DKA, and then also they titrated with like an order set that they could titrate up this high. So I would say that's like more free range. Now, in the PCU that I'm in right now, we are not allowed to titrate cardiac drips. We have to call the doctor specifically and tell them, hey, the medication, it's too high or too low. It's messing with the patient's blood pressure or heart rate. Can I titrate it or can I shut it off? Can I titrate it up? Can I titrate it down? Can I shut it off? They need a doctor's order, so they can't freehand it through a protocol order. The other thing too is they don't take care of DKAs on the floor. They don't take care of peritoneal dialysis. There's a dialysis nurse that does that. So just, it's nice to know what type of drips that you need to focus on. Again, especially for new travelers. Number 4, just in case the interviewer doesn't really mention what types of patients you see, just ask them ahead of time. In your nursing experience already, you should have seen all this stuff. So you're just brushing up and freshening up everything. You want to be best prepared, best foot forward. You want to be able to take care of your patients properly. So hey, at least you can brush up on those tips to be like, okay, these are things that I have to watch out for, like heart failure patients or sepsis patients or stroke patients. These are the things that I need to do in this type of emergency. Just be prepped up, just be prepared. Number 5, what is the nurse to patient ratio? And then how many techs do you have on the floor? Obviously, you're in a travel assignment, you're going there to fill a need, so they're not going to be the best in shape for staffing. Hearing and like consolidating like, hey, this is how bad it is on the floor. We're a progressive care unit, but you can have 4 to 5 patients instead of like the 3 to 4 patients that you may have. you know? So just kind of prep yourself in your mind for that to see how much help you'll have on the floor and how many patients you're gonna need to take care of. It just makes all the difference. Again, knowledge is power, and then it's more things to help prep you up and then make you feel better about everything. For number 6, the floating situation. So nobody likes to float 9 out of 10 times, unless you're one of my floaters out there, my float peeps who are in float pool. Thank you again for all your help and all that you do. We appreciate it. But yeah, 9 out of 10 times, if you're on like a scheduled unit, nobody wants to float. You being the traveler, unfortunately, a lot of places, they'll end up taking you and try to float you as many times as they want. Just make sure that you know what the floating policy is. Ask if they have a rotating schedule. Speak up. Don't not just say anything, because again, you're gonna be your own advocate at this point. They're not gonna know you, so they're gonna need to get to know you. So they're gonna wanna know if they can walk all over you and you're a yes, yes, yes person, or if you don't think something's fair, you'll speak up and say something. Okay, number 7. Due to the pandemic that we're in and the COVID situation, ask about fit testing right off the bat. I was not really oriented on the whole PAPR situation that I was dealing with. So when I went on to this unit, you know, I was already assigned a COVID patient, and I was like, I have not even been fit tested yet. Luckily, it was on orientation. You know, my orienter, she was able to take care of that patient, but at the same time, it's just like, you expect me to take care of a COVID patient, but you haven't fit tested me? Like, what's up with that? So unfortunately, I'm one of those people who don't fit in a 95, so I had to use a PAPR machine. So I wish I had gotten orientation on it because nobody really knew how to use it. And they even called the supervisor, or the supervisor was rounding down one time, and I even asked like, hey, is this properly on and this is how to use it? She didn't know it either. Make sure you get those orientations in and ask about that. Otherwise, you're gonna be stuck just guessing, and you don't wanna do that in that aspect because, again, you wanna be safe, you wanna take care of your patients, but yourself too, especially if you're coming home to somebody. You wanna make sure that they're gonna be safe. In retrospect, it's not a big deal as long as you speak up and as long as it gets fixed. If it doesn't, then that's another story, and you should talk to your travel agency about that, or even the manager. Oh, this was interesting too. It was nice to know, like, are nurses responsible for their IVs, or does like a SWAT team come up, a clinical support person come up to place an IV? Like the rule about drawing from pics. Originally, where I got my experience done, we drew from pics all the time as long as we had an order in. Same at the other hospital that I went to in Washington, and the hospital in Pennsylvania. They actually, I'm not sure if it's because the rule is changing, we're not supposed to draw pics even if they have them in and there's like an order to like use the pic. I don't know if it was just a hospital thing that changed it, or if there's a national movement in us not drawing blood off of pics. Hey guys, this is Editing Christina. I just forgot to mention like 2 points over in the video. So I think for question 8, you want to ask, are you responsible for sticking your patient, or is there a phlebotomy? You okay there, Shadow? Is there a phlebotomy team that's readily available 24/7 that's supposed to draw your labs? Or are nurses responsible for drawing patients' labs? So it's just things that you like want to make sure and verify. Half the time it's like, you're the nurse, so you have to take care of your patient, and if phlebotomy does not come on time, then you end up drawing it. Or the other 2 hospitals that I worked at, they both had adequate phlebotomists. Yes, given they were short, but still they came on time, or always 2 hours or an hour and a half before a draw. We never were expected to draw our own labs unless there was like a huge emergent situation. Number 9, the other thing is, what type of system do they use over there? Is it Epic? Is it Sorian? Is it Cerner? Is it MedTech? There's so many different systems for charting, and you want to make sure that you're familiar with it, or if you're not familiar with it, they're going to help you learn the system. you know? Because again, it's no fun learning it and like trying to chart everything, and also you have a heavy assignment. It's just not a good mix. Like, you want to make sure you give yourself, again, the best possible scenario. So don't hurt yourself, just learn, ask questions, and go from there. Make sure you ask about what specific charting on the unit do you need to do. For example, Washington and Pennsylvania, both the hospitals, they use Epic. But in the hospital in Washington, I had to chart a complex assessment, but that was the only thing that I needed to do, and that had to be done every 3 hours. Now, over here in, oh, excuse me, not every 3 hours, that had to be done every 4 hours. Over here in Pennsylvania, I have to do something called a simple assessment, and then 2 focus assessments. So just make sure, charting can be different across the board, so just make sure when you're doing your charting, or like make sure you know what is expected to be done in charting for your shift, just so then you're covering all your bases. The 9th question to ask on the interview, part of the question is like getting to page the doctor. So I've worked in 3 different hospitals so far, and there was always a different way to contact the doctor. So with Epic, a lot of the time people are using secure chat, or you know, there's Vocera, there is using a zone phone. Also, like, who are you supposed to contact? Do you contact the attending? Does the attending change after the surgery? Or does that medicine or a hospitalist team? Is there a resident that you have to get a hold of, or a PA, before you actually call the attending doctor? So just make sure you know who to contact first before you end up reaching out to them. Oh, also there's, you know, a healthcare system with like Kaiser, where you have to message them through, and that's like a difference between like a hospitalist patient and then there's like a Kaiser patient that you end up paging and like messaging. So that's for point 9. All right. So I think that's it for the video. Thank you for checking me out and taking a look. If you have any questions, feel free to comment down below. It would be great if you could like, comment, subscribe, tell your friends who are interested in travel nursing, check out this channel, or they can definitely message me on my email address, which is in the info box down below. My Instagram handle is also there. You can DM me over there. And then also my Facebook page, A Travel Nurse Story. That link should be down below as well. Let me know if there's any specific topics you want me to cover. Thank you, youngins, for tuning in, and I'll catch you later. Bye. Boop.